Fox 4, the news station. Live for all North Texas. It's 7 a.m. and this is Good Day.
Drugs used by millions of Americans face a pretty tough review after being linked to heart and other health problems. We're going to talk about what you need to know coming up.
Plus, and coming up next, a warning for parents and for some patients about some widely prescribed drugs. Millions of Americans, many of them children, take medications for attention deficit hyperactivity disorder. The FDA apparently will reject calls for stronger warning labels on those drugs. Dr. Rama Pemaraju Rao here to explain what patients and parents need to know, particularly because so many kids, by one figure I saw 10% of American boys under age 10 are on these ADHD medications.
That's true. In any 30-day period, this panel saw that 2.5 million kids are on stimulants and 1.5 million adults.
And what a lot of folks may not recognize is you've got kids and adults, for that matter, who are hyperactive, and you put them on stimulants. That seems to be a disconnect.
Well, in the brain, norepinephrine and dopamine seem to be depleted in attention deficit disorder. And so these medications increase those levels in various parts of the brain. But in other parts of the body, it still acts as a stimulant. And that's part of the problem with the issue of hypertension, stroke, cardiovascular and heart attack, and sudden death. And so this is an issue that's being studied by the FDA.
Also, some behavioral problems may be linked to them, including thoughts of anxiety or suicide in some cases.
Suicide might be more for antidepressants, but certainly psychosis and other difficult symptoms can arise, including agitation and other things that are kind of unwanted. Kind of an unwanted aspect of the medication.
So any parent would ask, and any patient who's on them would ask, is it worth the risk? What's your opinion as a physician?
You always have to weigh the benefit and the risk. You really want to look at the diagnosis individually with each child. And the issue is, if the child really has that constellation of inattention, impulsivity, and hyperactivity, chances are they really will benefit from these medications because it'll help them in school, it'll help them learn, it'll help them focus and pay attention, and their whole self-esteem will be greatly improved. It's better than having the child constantly being called down by teachers and parents, and they can have a much more smooth school life.
Right. What should you look for if you're a parent, though, as far as any physical signs that maybe there is a bad reaction to this, or are the patients required to go in for regular physical exams, for example, for the heart problems?
Well, that's why we, in child and adolescent psychiatry, we do see kids regularly. And yes, you do need to periodically check an EKG, you need to periodically monitor blood pressure, but parents are very intuitive and they know what's going on. Some kids can be over-medicated, so they look like they're too zombied out or too spaced out. There can be agitation and other side effects that can be a problem, but then again, that's why close monitoring is necessary.
And briefly, the FDA got 2 advisory panels to look at this. One said we need a dire warning called a black box warning to warn patients, and another panel said, not really. What do you think the FDA might do?
Well, they're waiting for the pediatric committee that met last week to make their final recommendations. The issue more was that there was an alarming rate of prescriptions that have been written from 1999 through 2003, some 92 million total, compared to the past 12 years. And as a result, they wanted to have doctors be more aware of certain cardiovascular events, not because of the risk, but because of more prescriptions are being written.
Right. Good warning.
That's right.
Thanks very much, Doctor.
Thank you
we appreciate it.